So we'll now hear from Rachel, from the Rachel Powers from the Patients Association. I won't use your analogy of the sandwich, Caroline. I think as friends you can do that. I don't think I should. But Rachel, thank you so much for being with us this afternoon. Just briefly, Rachel joined the Patients Association in 2017 as Chief Executive and has led dynamic change in the charity, leading to a more engaged membership and an increase in profile for the Patients Association and its goal of embedding patient partnership in the design and delivery of health and care services. Rachel was described by The Times as the UK's foremost patient campaigner. So we really are delighted to have you with us, Rachel. Thank you very much. And can I pass the floor over to you for about 15 minutes, if that's okay?
Yes, thank you so much, Chair, and thank you for inviting me.
No.
And I did say to the organisers, you had Nadra and you had Caroline, and you actually didn't really need me, because you had the two people in the room that needed to be in the room. So I think what Caroline just said there is completely right, and it is, you know, apart from a moral interest in social care and elderly parents, and going to get old myself, we can't have health without care. And I think that's the really important bit that we need to think about, that integrated care from birth through to death. So as a representative of the Patient Association, we're a national charity and we work directly with patients through our free phone helpline, our surveys, our patient engagement work. And we do talk to thousands of patients each year who are depending on health and care systems. And we work with CQC around Tell Us Your Care, and we hear from a lot of family and people important to loved ones about how to access both health and care. And we're an information and guidance, but signposting as well. So we regularly would signpost to Age UK and other organisations. But I think I think the first thing I want to get it, I think you all get that, but this is about real people. We often have numbers and we have stats thrown at us, and I know there's how many million people waiting for treatment, and you know, but this is, and we're looking at, like you said, Caroline, at a miserable day, and we have left vulnerable in our society without the right support that they need. And you know, regardless of my hardness, sometimes that makes me really sad. So I stand here because I'm really guided by our patient partnership principles, that everybody, and I think this is everyone, and we can, you know, social people using social care as well, are treated with dignity, compassion, and respect, that have services that are joined up around them, and that people are treated as equal partners, and that their needs are prioritized through shared decision making and partnership, and that they get the information that they need to live their best lives. And my previous history was working in children's hospices, so I really got having to live your best life, despite how short sometimes lives could be for people, and for children in particular. So these principles, I think they're not, you know, the principles that we developed with patients and healthcare professionals aren't ideals. They're actually the foundation of any healthcare system. And, you know, I think there's something that we need politicians across all colours to think about as they move forward. So we hear often about people just not being able to access the care that they need. And I think one of the things is what I call kind of the perfect storm of care. And Caroline, you brought this up when we were in another meeting together this week, but it's something that we've thought about a lot. But you know, an elderly person arrives in A&E, you know, maybe after a preventable fall that could have been avoided with that proper community support and falls prevention programs. And it's not just medical challenges that people are facing when they end up in hospital. They encounter that fragmented system that often fails to recognise their complex needs. And they face with the long waits in environments that can be really overwhelming and frightening. And having been there with my dad sometimes, I watch this happening to a lot of older people in A&E. And especially those with dementia and other vulnerabilities. And as a patient association, we gave evidence to the COVID inquiry, and worked with Julia Jones, is one of our core participants from John's campaign, who talked about, you know, the rights of having a loved one, your carer, with you, and these things are happening. And Caroline, I know you were there giving evidence a few days before that as well. So you know, hospital is the worst place for a majority of elderly people, unless they just get in and get out and get their treatment done. But then what we do here, and what I hear from all my, you know, colleagues, is that a lot of time the care that they do receive then will depend on their postcode. So our chair had their mum and dad both very sick in the last couple of years, and because they were crossing local boundary lines, they were ending up in different worlds of care, different eligibility criteria, different services, discharges that just weren't managed. A discharge team saying to Julie, you don't call us, we'll call you, as she was trying to organise end-of-life discharge for her dad. So a person in Liverpool should have the same access to quality care as someone in London or Leeds do. So I think, and then I know that you quoted this in one of your resolutions, which was the Association of Director of Adult Social Services saying millions, yes, millions of our fellow citizens who are in pain or distress because they aren't getting the care that they need. That's not good enough. So at the heart of that as well then lies another issue for us at the Patient Association and for some of our colleagues at Carers Rights UK and Carers UK as well, is those unsung heroes, both paid and unpaid, and the backbone of a care system. And Nadra, you spoke about that, and pay and value. And when I worked in hospice care, I saw that. How do we, society, we need to value the work the carers and those people bring in, and support workers bring to making life really good for people. So I think for me, and I'm not going to go into adult social care reforms because I think Nadra and Caroline know that so much more than I do and have the facts and figures. But there are things, but we do need, there are things that I do think we need to really focus on. And one is that comprehensive workforce strategy. And Caroline and Nadra were right. We need a national conversation about social care because we need a workforce strategy that needs, that transforms social care into a career of choice, one that means that there's proper training pathways, career progression, and fair pay that reflects the skilled, demanding culture of that job in caring for people. And then we need, really, one of the principles of patient partnership is that's, you know, that genuine service integration, that services are joined up around patients and elderly people and people needing social care. And there has to be that removal of those artificial boundaries that we hear so often. I'm sure Nadia and Caroline can talk of it from a social care, but we hear it from a patient's point of view all the time. It is not joined up. You are repeating yourself all the time. You are not, you know, we're not giving holistic support. We're not looking at the whole person that looks at their medical and their care needs, but not look at them separately. Look at, you know, what matters to that person, what's really important to that person, and how can we enable that person to live the best possible life that they can do. So I think that's really, really important as well. And we shouldn't have to navigate multiple systems or tell their stories multiple times. So I think, again, Caroline and Nadia know more about this, but whilst we really need good local care, we need proper care frameworks that address the whole country in terms of health and care that can be implemented locally so that we don't lose voices to those people that we're not hearing, both in health and care. And Caroline's talked about chairing that group, and we're really happy to be working and trying to work with all the groups there. But, you know, if we think about the one shift that the Labour Party are talking about now, and I'm going to get the shift wrong because I've just decided to get it wrong in my head. So from hospital to community, you know, the impact that that shift can have on social care for health and care for patients. So that seamless transition from hospital to home, community teams ready before patients are discharged, district nurses, occupational therapists, social care workers, all working in coordinated teams that are looking at that whole person. Community pharmacy, the role of community pharmacy, which I think we need to talk more about, because they're struggling, and that's going to have a huge impact on social care as well if community pharmacy continue to close as we see that they are. So health visitors going in, checking on progress. Nadra, somebody just going in 1 hour a day, it's not good enough. We've got to build everything around that. But health, you know, that kind of would keep people well out of hospital, which would have a huge impact on people coming in to get the treatment they need. And you know, we hear that horrible word around bed blockers, like just what a horrible word to use about people who are in hospital. But people who are physically and medically well enough should not be staying in hospital, because they're better off, they're going to do so much better in the community and being cared around the people that they know in the community that they love. So I think the other kind of shift is from illness to prevention, which I think is really, really important. This isn't, you know, and sometimes we talk about efficiency and effectiveness. And I think if we put the patient and the carer and the person at the heart of what we're doing, we will have an efficient and effective service, and we will save money. But that shouldn't be the driving point. The driving point is our society and people living well. So we do stand at a crossroads. I'm with Caroline. I'm positive about the future at this moment. I do worry a little bit about the fact that we are going into what is going to be a very difficult winter, and we have a big focus on a 10-year health plan, and what are we doing right now to make sure people don't get sicker through this winter. That would be my negative part of my positivity, and something that the Patient Association is trying to work through as well. But we do have an opportunity to reshape our health and social care systems in a way that it really will truly address everyone's needs. And so I hope you're all feeding into those national conversations that are happening, because whatever people's colour and political views, this isn't about politics. This is about the future for health and social care, and that we really need to make sure that our elderly receive the care that they deserve, and that it's there regardless of where they live. It's about supporting that workforce as well with the respect and resources that they deserve, and it's about giving family members and those people who are close and loved by that person the need and support to continue that vital role. So I'm going to finish with saying I will talk about patients. This is about putting people at the centre, value our health and care workforce, support our carers, and create a system that is much more sustainable and equitable for everyone. So thank you.
Thank you so much. Thank you very much indeed, Rachel.